PacMOSSI is a project that we're leading with James Cook University, the World Health Organization and SPC in collaboration with a number of institutions including Queensland Institute of Medical Research and together with the Pacific Island countries.
And the whole purpose of the programme is to develop the skills of Pacific Island countries in terms of vector control and vector surveillance. So vectors being largely the mosquitoes that transmit diseases.
And it's focused primarily on Aedes mosquitoes, which transmit dengue and Zika and chikungunya, and the anophelines, which transmit malaria.
Very few people have been trained in entomology and know how vectors behave in the region, and that's very important in trying to control and address vector-borne diseases.
As travel ramps up across the Pacific, countries are at increased risk of imported diseases like dengue. WHO is working with PacMOSSI Consortium to help prepare, prevent and respond.
With COVID, because the borders have been closed, dengue really was reduced across the last couple of years. So there's quite a high risk now that dengue is going to start coming in as the borders open.
Dengue is the fastest growing emerging mosquito-borne disease that we have, with over 400 million cases annually across the globe.
For every insecticide, you use 6 different tubes.
For many diseases, there are no vaccines and there are no chemotherapeutics or drugs, so we're entirely reliant upon control of the mosquito in order to control the disease.
We're focusing on insecticide resistance, which is a really big threat.
Insecticide resistance is a real worry, particularly because most countries don't monitor insecticide resistance.
You have to know which insecticides the mosquito is susceptible and resistant to. The other problem, which I think is far more dangerous, and that's what we call behavioral resistance, where the mosquito avoids contact with the insecticide. A lot of these mosquitoes won't enter the houses, or they'll bite outdoors and early, so that destroys the whole paradigm. So you have to then have an entirely new way of approaching how you're going to control those mosquitoes.
And at the same time, like a segregated net.
It's incredibly gratifying for QIMR that we've been the institute kind of chosen to run these courses, partly because of our unique facilities in terms of the mosquito colonies that we have here, and the expertise of the mosquito control laboratory itself.
So I have done the first one, then put it like this.
This training is important, especially to us back in Fiji, because we need to improve on our vector control operations.
I know it's going to be very useful for us as environmental health in our own country to try to combat the vector-borne disease.
This is a big opportunity to working together with the community to understand more about the control of surveillance, to know more about the mosquitoes.
So we need to have something that's more affordable, more practical, and it's useful in terms of services that we provide for the public.
Although when they go back to their own countries, they may not have the same kind of facility, but at least they have the foundation, the knowledge that's being shared.
And we've been working together as a big community to tackle this problem.
It's really wonderful for the Pacific.